has a question? We have maybe one or two. Does anyone have a question?
It's a quick question. Well, first of all, thank you. That was very elucidating. The propofol, yeah, what, based on its characteristics, what do you think the concerns may be? I know the research hasn't done, but you know how it works biochemically, so I'm just curious.
Right. Well, we don't think it has any harmful effect when it's used in clinically relevant doses, but we're really more concerned about these very small chronic exposures. And, you know, it's really hard to say. I mean, I don't think anybody has any particular preconceived notion, but we do know that it acts on the central nervous system, and that's how it works. And so we're kind of concerned particularly about possible CNS toxicity. And it may be something as subtle as autism in children, you know, something that would take a lot of study to prove. And, you know, you can show in laboratory animals that it has effects at low doses, but nobody really knows. It's concerning though that so much is in our water, and people do get exposed to it. It's kind of like saying, well, is there a problem with fentanyl being in the water system? And it is. It is in our water system. Well, we don't think it's good to be in our water system. We just don't know what harmful effects it may have. Yeah, I don't think anybody knows.
So on the understanding besides CNS, what other things have you seen in the animals? What other things are you looking at? Just also disease?
It's mostly neurotoxicity that they're looking at. Yeah. So.
Oh, thanks. Thanks, guys. As an anesthesiologist, I appreciate all this. But I wanted to mention, and this is just a statement in addition. I've been at other conferences about some of this, and there is evidence, and they're looking at fish in the Caribbean with how various pharmaceuticals have been affecting them. And it's not just stuff that gets in the trash, it's the things that are going through our bodies through the waste system. And they're finding these fish with up to 18 different pharmaceuticals in their body, and cardiac stuff, hormones, everything. And there's no great way to get rid of this stuff. These researchers in Sweden are using an ozone treatment to treat sewage to knock that out, but then you get the ozone thing. So then they're trying to come up with some other things, but these fish don't act normally, and they don't run away from predators, and it's coming from their food too, all the way from the bottom up. And it's very concerning. It's very concerning, and it's again not just stuff we waste, but it's stuff that we are taking and going through our bodies.
You may have noticed on the one slide that looked at the various ways of looking at maybe the potential toxicity or bioaccumulation of the drugs. On the column on the far right, which would be sort of a composite, ibuprofen was number one. And so we don't throw ibuprofen down the trash. It basically goes through our body, and there's enough active ibuprofen that gets into our water system that you can measure it, and it's number one as far as the amount of drug. So
we have a question from online we'd like to ask.
Let me just comment on one thing. Those cause effect is very difficult to establish. Take PFAS, that is only after decades of being used. PFAS are those forever chemicals. Only now have been taken out of the market. The use of it will be taken out of the market because it took decades of big populational studies to show that there is agreement between the PFAS, or a correlation between the PFAS use and the development of cancer potential. So if we taking hundreds of chemicals, medications that we are using, and they are ending up in the wastewater and water supplies, it will be extremely difficult to find those associations.
So, thank you. Thank you so much. This will be the last question for this session.
This is
And
from
what is it?
Laura,
Yes.
and she asked, what are current interventions anesthesia can consider? And then she suggested more blocks with twilight sedation.
Yeah, I think that is one of the things that's been proposed, is they say that regional anesthesia is probably the least environmentally harmful anesthetic, so say a spinal instead of a general. But we're sort of in a culture where everything gets thrown away. So our spinal trays, I could have put a picture up there of the spinal tray that I trained with. Everything on that tray, the syringes, the needles, everything was reused. It was re-sterilized and reused. And now we just open up a disposable tray and everything is thrown away. So, but avoiding the anesthetic gases is one way of decreasing the environmental load. But unfortunately, you talked about twilight sleep or whatever. Propofol is probably the #1 drug that's being used for sedation. And of course, we think propofol may have its own concerns.
So obviously, we ourselves like to do whatever can be done with the block and quote sedation to be done with this technique, but it's not always possible. There are multiple surgical procedures that have to be done with general anesthetic. Our role is to make sure that we are using it in the least environmentally impactful way that we can.
Thank you so much.